Weekly Renewal is brought to you by Calvo Select Care.
Hop a day, I'm Claire Calvo bringing you your weekly renewal. Today I am here at Horinuchi Wellness with none other than Dr. Keith Horinuchi, who is a functional and nutritional medicine doctor. Hop a day, Dr. Keith
Hi.
Horinuchi. I never called you by your full name.
Yeah, oh no.
Can you just share a little bit about what that entails?
Sure. Well, my background is basically dealing with lifestyle, nutrition, exercise physiology. But when functional medicine came around, I started to go to conferences and to learn this new area called functional medicine. So functional medicine is looking for the root cause of the problem. And the experience that I have is most of the issues are nutrition related. So I try to go down to the root cause and try to fix it at that level. Digestion is really the core of good health. And in my practice, it's actually been surprising to see how many people have digestion problems. Before, in my training was lifestyle medicine, I guess you would call it.
Okay.
Yeah, so it's more of the basics, you know, just eating well and having exercise,
Right.
managing stress. Yeah, before the functional medicine came out.
Okay, and so how would you, so there's conventional medicine, you know, when you would go and see the doctor, what are the differences as far as when a patient comes in to see you, as far as, you know, going through like a diagnosis, for instance, or if someone comes in with like how I have before, fatigue or feeling a little bloated, can you take us down, you know, a few steps of how you would approach that?
Well, nowadays people are quite aware that there are some alternatives, you know, than just taking medicines.
Right.
So people are well informed today because they do a lot of research, you know, online and through books, and so actually that makes my job easier. Before I used to try to convince people and tell them what functional medicine was,
Yeah.
but now they know, so they're looking for a different approach, and they're really trying to find, you know, a fix for their problems. So medicine has its place. It's very, very important. I go to a medical doctor.
Right.
But some areas they don't really specialize in, like you were saying, like with just fatigue or just some hormonal imbalances, and so they have some different symptoms, or you know, just other things that's related, like can't sleep well, having cramps, you know. So there's a lot of things that
Rash and skin issues.
Oh, skin issues, yeah, allergies, you know. So of course, dealing with the digestion, I have a lot more tools to look to see maybe what's going on with the digestion that might be related to skin issues, rashes, or other kind of digestion symptoms.
So as someone who's come to you for many years, I feel like I've taken many of the tests, right? Everything from checking hormones, checking for mold in my system, checking for heavy metals. Would you attribute a lot of, aside from nutrition, would you attribute a lot of like the health challenges people are experiencing to also come from heavy metals and from more environmental toxins as well?
Yeah, that's a really good question, because so I graduated in 1982, so I've actually been working in the field for more than 40 years, and so I've seen a lot of changes, you know, with nutrition, and our environment has changed a lot.
Right.
So today, a lot of my focus is how can we reduce the effect of toxins?
Yeah.
Because I think that's a big risk factor today.
Yeah.
Is our ability to detox is lessened because of our poor nutrition, but the amount of toxins that have accumulated in the environment, in heavy metals, in the fish, and you know, just pesticides, cleaning you know, materials, our exposure to toxins is really high.
Right.
Yeah, and so to detox better or more efficiently is really a key factor for being healthy.
Thank you. I will see you next time for part 2 of this series with Dr. Horinuchi.
Weekly Renewal is brought to you by Calvo Select Care.